So my 2-minute pitch is on the case about human research trials that were done overseas in Haiti. Cornell Medical College ran a study on heterosexual couples in Haiti. They chose couples where one partner was HIV infected and the other was not. The purpose of this experiment was to find out if some people had natural protection against HIV. The researchers studied both partners' blood, especially the unaffected ones who were still being exposed to HIV. The patients were told since they lived in an area where HIV was common, they would have their blood tested for the disease. The researchers did not inform the patients that their partner was infected with HIV. Patients were also told that if they became sick during the research, they would be given treatment, but they weren't given anything to protect themselves from the disease. The statement for this case is that the Haiti couple's human research trial is unethical. The next 2 slides are just a quick overview of my argument, which I'll then. So, to the principle of autonomy, and first thing is just that patients' autonomy should always be respected, which leads to 2. In order for a patient to make an autonomous decision, they need to be fully informed. Informed consent requires 5 things. 1, a competent patient. 2, adequate information is disclosed. 3, the patient fully understands the information being told to them so that they can, 4, decide freely on the treatment, and then finally the patient can consent. I also added a chart on the side to clearly show the 5 characteristics of informed consent, which here are benefits, alternatives, nature of the treatment, risks, opportunity for questions. Consent form, which was also read out loud in Creole to all the patients, did not include that the study was focusing on couples with one partner who was infected with HIV. The patients were not disclosed all the information about this trial. Patients in this case, most of which could not afford food, were told they would receive medical care if they became sick. Therefore, the patient's decision to consent to this case was coercive. Lead to the conclusion that the patients in this case were not fully informed and therefore could not make an autonomous decision. The second part of this argument pertains to the principle of justice, which says that all people should be treated equally. Even though the study takes place overseas in Haiti, it should be held to the same standards as it is in the United States. Cornell did not provide protection or antiretroviral drugs to the subjects in this study, which are drugs specifically made to protect against HIV. Cornell was exploiting this population because they could not afford the same care as they do in the United States just to gain medical knowledge. Therefore, they were violating the principle of justice. Finally, because the patients were not fully informed and could not make an autonomous decision, and the principle of justice was violated, the Haiti couple trials were unethical.